Hello, everyone, and welcome. Thank you for joining us for Firestorm's Crisis Coach November Communicable Illness. Today we're going to talk about flu season, but we're also going to talk about the impacts of natural disaster and communicable illness. You, your teams, your families, and your businesses healthy during a time when disease is more readily spread. And we just went through this season, so I think we have a lot to talk about in this area. As always, we would like you to engage with us on social media if you so like, and we can be found on Twitter at Firestorm Soul, on Facebook at Solutions, and as always, if you have a question, you can use the hashtag on any occasion, Crisis Coach, and we'll see that, and we can answer any questions that you may have or listen to any comments that you'd like to share. You can always email us at webinars@firestorm.com or go to firestorm.com website and contact us. Firestorm transforms crisis into value, and we empower you to manage crisis and risk. And our expertise is in crisis management, critical decision support during a crisis, crisis public relations management, and consequent management. And we are your crisis coach, and our expertise is in crisis and risk following the Predict.Plan.Perform methodology. As a reminder, this presentation is not complete without accompanying oral comments and discussion. Now, any work product provided by Firestorm should be read in conjunction with any guidance given by national, regional, and local authorities, as well as your company's personal counsel. Moreover, the information given and comments made in this webinar should not be interpreted as legal advice or legal opinion. I'd like now to talk a little bit about our great friends at the University of Alabama. We have some exciting news related to a project that we've been working on, and I'm going to introduce the fabulous Brenda Truelove to talk a little bit about what's coming up in the world of the University of Alabama and Firestorm. Brenda?
Well, thank you, Karen, and good morning from the campus of the University of Alabama. I'm so excited to let you in on the first secret that we've been holding this week is that we are ready to roll out our birther program in conjunction with our great friends at Firestorm Threat Assessment Program. We've been working on this project for over a year, and Firestorm has been working to develop this program for over 6 years. We've come together to develop an online training program for all schools in Alabama K through 12. And our program is unique in that we will be able to help school personnel recognize and more importantly be able to respond to early warning signs related to behaviors of concern that their students may be exhibiting. We hope to be able to let the whole world know that we have an online training program that will help the behavioral management team personnel in each school be able to get this training being underwritten by the University of Alabama in cooperation with Firestorm. Other schools across the United can have access to the licensed material through Firestorm, but in Alabama, the University of Alabama in cooperation with Firestorm is underwriting the cost for 1 year of the license. You're seeing screenshots of what the online training platform looks like. It's step-by-step. It gives you all access to all the forms and the material and tells you exactly what to do step-by-step. And we are beyond excited. We get excited here on our campus about a lot of things. We also get excited about learning platforms in their day-to-day work. So our BAMA at Work team is very excited to roll this out, and we already have a few people signed up, and we're ready to go with the training, and we're very happy and thankful at Thanksgiving time. If individuals need additional information, our information on our website is bertha.ua.edu. And again, the first year license is being underwritten by the University of Alabama. It's our way of giving back to school systems in Alabama who've done so much for students and their families, and it's just a great end to a great year here at the university, and we're looking forward to 2018 and all the great training that will take place. Again, on the screen is our Bertha website, my email address, and my telephone number. Please let me know if you have any questions. Thank you, Karen.
Oh, thank you so much, Brenda. And I just want to quickly go back to a couple of these screens. The amount of work that Brenda and her team at the university have put into making one of our heartfelt initiatives come to life has been tremendous. To see all of the program contents, all of the program documents easily accessible in a course dashboard in a way that your entire team can benefit from is just a really tremendous thing. Plus, it's a lot of fun. The actual videos, there are both real-life videos, demonstrations of forms, and then some of this terrific animation. And if you look at the last picture of Brenda Truelove and see this image here, I think you can see that they are pretty great representations. That is Jim Satterfield on the right. They both have some great conversations through the video, so you get to listen to these leaders talk about how to truly implement a behavioral risk threat management program, and it's an invaluable program for Alabama schools. Again, the cost is being, the first year license fee is being underwritten, but I don't want businesses to be discouraged. You're also able to secure a license and just contact webinars at firestorm.com or any of us, and we can answer questions for you, or bertha.ua.edu. There are a variety of types and sizes. If you're not a school, we can still implement a program for you, so please don't hesitate to let us know. So we're going to move on, but we're very excited about this process, and thank you to Brenda and her team, and we look forward to a terrific 2018 in partnership. I would also like to say that we have a great initiative coming up on December 7th of this year. We'd like to make sure all of you on this call today who've taken the time to attend our Crisis Coach webinars are aware. We're going to have a 2-hour, the last virtual tabletop exercise of the year, and the subject matter is terrorism or lone wolf. Does it matter? And it's going to be a virtual tabletop exercise exploring an incident of violence, and you can get your teams around conference tables, and you're going to be able to spot your gaps and your strengths and your weaknesses and shore up your programs as we roll into 2018. You're going to be better prepared than ever before. My name is Karen Masulo. Thanks for joining us, everyone, and thanks for joining us all year. Jim Satterfield will be with us in December. In addition to being at that virtual event, Jim is going to wrap up the year for us in Crisis, so don't miss those 2 events in December. Visit our website calendar to register and grab a seat early, especially on the virtual one. I am the Chief Intelligence Officer for Firestorm, and I know that because it says that right there on the screen. And joining me today is our guest and Firestorm Principal, Ken Mercer. And Ken is with us for a very specific reason. He has a specific expertise around this area. Ken, would you like to introduce yourself to our friends at the University of Alabama? Or not? Ken, are you there? Are you on mute? Okay.
I think Ken is self-muted. Ken, unmute yourself.
No, I think he just came back in.
Here we are.
Yeah, he was, there he is.
Is that right? Okay. Sorry about that. I was trying to get rid of the feedback on the phone, as you suggested. So thank you, Karen and Brenda, for underwriting this program today. I am a graduate of the West Virginia University School of Pharmacy. I have a degree in pharmacy, which brings me to this topic today in a healthcare background. I am licensed in 3 states, but I practice in Maryland. I live in the city of Baltimore. I have 3 kids and 2 grandkids. In fact, one of my children is my Firestorm business partner. Some of you may have interacted with Ryan Mercer over the phone in the past few years. I was also recently appointed to the Academic Advisory Committee for the Emergency Management Program at Frederick Community College. They offer a 2-year associate's degree in emergency management, excuse me, have both traditional on-campus and online programs. So if anyone is interested in that course of study, I would encourage you to check them out. You can feel free to contact me if you need more information. My email address is on the screen. So thank you, Karen. I look forward to this morning. Thank you.
Oh, thank you so much, Ken. I appreciate it. And so Ken is joining us because he has a great insight into the healthcare industry, and as a pharmacist for many years in a hospital environment, he can speak to a lot of the challenges that we know we face. Now, when Ken and I were talking about creating this session for this month, we thought, well, we can just talk about communicable illness because, you know, we have a program, we have a toolkit, but let's also talk about the impact that natural disaster has on communities, because this year we have seen so much of it, and sadly every year we do, and we really need to group those things together. We started off with a survey, and this was the survey from last year. Each year we do a survey. We did one this year as well. And after all of our webinars for the year are done, we're able to compile all the results that we've asked of different groups. We usually get a sampling of anywhere from about 400 to 700 different company representatives and school representatives. And we said, have you personally read your organization's communicable illness plan? Now, that number, 62%, is up from last year, so that makes us feel great. That means people are thinking about this, compiling documents, sharing them, and communicating. But a lot of people have said, not only no, I've never seen it, but what's a communicable illness plan? So we still have some work to do. So if you fall in the blue or that sort of maroony box over there, great. I'm glad you're on this session today, and we can help you expand what a communicable illness plan should look like in good times and in stressful. What we're looking at right now is just a real high-level overview of risk factors that go along with a natural disaster. And Ken, do you want to talk about this real quick for us?
Sure. Thank you, Karen. Across the bottom axis, we see the types of communicable illness and how they're transmitted. Water, vector, which is rats, rodents, mosquitoes. Across the left-hand axis, we see the risk factors. So these are the things that we see prevalent in around a natural disaster. We have populations displaced, we have overcrowding, we have insufficient contaminated water, we have poor sanitary conditions. All of this is due to displaced people that are forced to live in tight, crowded spaces. They have lack of food, they have lack of clean water, and general lack of cleanliness. Minor illnesses and injuries through the natural disaster worsen without treatment. And the healthcare system in the community around the photo on the right there, that healthcare system is damaged also. It's not capable of keeping up with the needs, the growing needs of the population. You have broken facilities that used to be open aren't open. They have broken supply chains. They don't have the supplies they need, and their personnel chains. The personnel in this environment are also involved in the same catastrophe that everyone else is, so they can't come to work. So we have a lot of things that lead to the development of communicable illness around a natural disaster. Thank you, Karen.
Thank you, Ken. And as we look at this, one of the things that we know is that flooding across the country is one of the #1 threats that we face in terms of natural disasters. Alabama specifically has some real challenges. Flooding is #1, and we have tornadoes and hurricanes. So you really get that triple whammy of challenges plus a variety of others. And so we need to look at it from the perspective of not only is your state challenged from this point of view, but the states next to you are, which creates an issue for Alabama. We just had a really significant group of weather events that happened, and people were displaced. So we had people from Florida coming up and going into Georgia and Alabama and other areas. And those displaced people may be permanently displaced suddenly in your areas, in your school systems, in your businesses looking for work, but we have new health challenges because of that, new outbreaks that travel from one region to another. And one of the pieces that's important here is flooding is such a common event that happens. And it is one of the #1 causes for challenging disease outbreaks. After floods, it's found that there's always an increased risk of outbreaks, hepatitis C, gastrointestinal disease, and others. And if you go to the Alabama publichealth.gov webpage, you can see what current outbreaks or challenges are occurring in your area. It's a good idea to keep your eye on that. Why? Because you need to know not only if there are health challenges you need to educate your teams about, if you're in schools, your schools, but also are you going to be faced with employee or student absences coming up, and are you going to have to plan for that? And we'll talk about that in a little bit. You know, for the last couple of months, we've been on this subject. We started out with business continuity and natural disasters, and then we talked about where would your business live if there was a natural disaster and you had no power, no clean water for an extended period of time? Well, now that we've talked about the business or the building types of pieces of schools and employment, what happens to the people themselves? The psychological distress factors are also very important to consider and can exacerbate physical illness. So we want to talk about our EAP plans and make sure those are in place. And then, as we've mentioned, we have those challenges with people being displaced from other regions, and that creates challenges, conflicts, and stress for everyone involved. Now, we're going to talk about some real basic pieces and parts of how disease spreads during a natural disaster. And even after things calm down, some of the ways disease spreads still exist. Now, I live in a coastal state. I live in Charleston, South Carolina. I'm not sure where this picture was taken, but it sure does look like our bridge that goes down into downtown into the hospital. And I don't know about where you live, but in Charleston, South Carolina, if someone cries, it floods downtown. We have no infrastructure. It's a challenge. They're working on it. But flooding is not something that is unknown to us. Fortunately, knocking on wood, I live in an area that doesn't flood heavily. But when you have heavy flooding, you get used to some challenges. And those are, well, we have gators here. I don't know what you have in your neighborhood, but I've walked outside and seen one walking across my street before. Certainly snakes come up from not only rivers but other areas, and if you have standing water in your yard or, God forbid, your home, that standing water can be full of critters and other very dangerous threats. We have not only spiders, but are you sure it is a spider bite? Sometimes things we think are a bug bite are actually something more serious, a more serious skin condition or bacteria. Certainly rodents are a problem, especially in flooding. If we get displaced, they get displaced, and they're going to be looking for a warm, safe place themselves. And then we have one of the biggest threats, and I think Ken will say the biggest threat that there is, and that is the lowly mosquito. So Ken, you want to talk a little bit about these challenges that we all face and what we can do?
Yes, thank you, Karen. We see two images on the screen now. These are both associated with floods. We have standing water. But I want to talk about specifically mosquitoes a little bit. Mosquitoes have been called the deadliest animal in the world because of the diseases they carry. Mosquitoes kill about 1 million people in the world annually. About half of those deaths are due to malaria. And while malaria is not prevalent in the United States, mosquitoes bring a lot of other things as well that become problematic for us. A can of insect repellent in your go bag might be a wise thing to carry with you. When I see the image on the right of the screen, again, I assume this is a post-flood. We have piles of trash from both sides of the street. I can assume it's wet trash. Just breeding grounds for rodents, rats, and mosquitoes in particular. Molds also. Molds, it's a good environment to grow molds. Molds, while they may not be a problem in a normal day, when you have an abundance of them, those particularly subject to respiratory conditions, the elderly and the very young, particularly asthma, that are often allergy mediated. These new allergens called molds in the environment create lots of new problems that you did not expect to have. Preparation is the key to success. So anything you can do in advance to prepare yourself for these kinds of images, not. Thank you, Karen.
Thank you, Ken. And you know, these images came out of Harvey, and we can, the image on the right, and we just saw this all devastated. And not only did we have these intense storms in the south and southeast, but as you know, the West Coast had some significant fires, and we have those as well in Florida and Georgia. And have you been driving on the Alabama or Georgia or Florida border, and we see the smoke from wildfires raging. So we know what a threat that is as well. And it is a threat to people, and they need to think about what that threat is. We have young children, elderly, anybody in your employ or be especially vulnerable. Lung or heart disease patients should make sure they've got their medication, you've got at least a 5-day supply of meds on hand, and your oxygen. Oxygen can be challenging, so make sure you're well trained on how portable canisters or non-electric oxygen generators are managed and maintained so that you don't create a secondary risk. And make sure that those students or employees in your control that may be at understand and the risk and how to weight them. You know, when high outside, there are some simple things we can do inside. If you're a school, maybe turn off the Bunsen burners. We're not going to have lab today in this particular way. Don't light the fireplace or your gas stoves or candles, especially scented ones. Any of that puts pollutants in the air. My favorite is not to vacuum. I'm all for that. If I can get out of vacuuming for a little while, I'm good with that. And for all of you who participated on November 16th for the Great American Smokeout, congratulations. I hope you're still doing well. And we're here to support you in that. And don't smoke. Smoking puts more pollution into the air. We know that, and we certainly know all of the other risks that are associated with it. For those of you who are on the call, though, who did participate, I do wish you the best of success. I'm really proud of you. So when we talk about this part of our session, and it concerns communicable illness as a result of dangerous situations or natural disaster, we know the reason is because the smallest little wound, when in dirty, filthy, standing water, can become a significant staph or other infection. We really need to prevent against that. We know that poisonings happen from the same thing, from bad food, from poor water, from tainted water, and that creates secondary gastrointestinal infections and certainly skin infections that may become exceptionally severe. And if we're not able to get to healthcare facilities to support us, how are you going to be your own first responder and take care of yourself at home? So one of the best things we can do for our employees and our students and our families and the families of our employees and ourselves is to become being a first responder for yourself. We have a great book. You can download it for free from our website. We'll give you the link here in a little bit, but basically just go to firestorm.com. There's a resources tab right at top. Just click on the book, Disaster Ready People for a Disaster Ready America. You can print off as many electronic copies at work. And if you'd like a customized copy, let us know. But it's a great way to make sure your teams at home are prepared. And we want to take care of all of these things that we see listed on the page, because this is why health care risks increase. I just want to mention this last piece before we move into communicable illness plans and what they need to contain. I don't know if any of you are familiar with this image, but it's a pretty strong one. This is of a group of elderly folks from a senior care facility being transported via a luggage container on an airport runway. And they're on cots and they're just sort of stacked, and it's a pretty shocking image. This is from Hurricane Rita. And I know most of us are thinking, well, it's been 12 years. We've learned a lot. This isn't going to happen today. And this picture that you're seeing on your screen now, I hope, is from Hurricane Harvey, which is much, much worse. I don't think anybody could have seen this picture. I know when I did, I actually gasped out loud. I don't think any of us looked at this image for the first time and were in shock to see it. And this is an example of what's happening in our healthcare industry. Now, I sadly forgot to update this little screenshot that says rule ready, because the deadline has passed. The deadline was November 15th, and the deadline to be rule ready with your 2017 emergency preparedness plan, if you are a healthcare facility, has passed. So if you're on the call today and you're a healthcare facility of any type, anything from a dialysis center to a senior care facility, and you don't know what the Centers for Medicaid and Medicare are saying about the 2017 emergency preparedness rule, let us help. Give us a call. The penalties are very high, and the main penalty is that you will not receive payments from Medicare and Medicaid any longer. This is a critical issue. We want to make sure that this image doesn't happen to people again in the coming year and coming years. Okay, let's talk a little bit about planning for communicable illness in your organization. The first thing is you've got to, what we would say, you just have to predict, plan, perform. So the first thing you have to do is examine your management practices and policies to make sure you're addressing communicable illness absences. Everybody on the call today, I want you to picture if 40% of the people you rely on to get your job done every day aren't there, what are you going to do? And if you can't answer that question, then let's move on to the next point. We need to talk about screening, monitoring, leave, absenteeism, and other HR matters that are critical and have strategic implications to your organization. Plus, we have to protect customers if you're a customer-facing business. If you have vendors coming through all day long, if you have visitors coming into your facility, if you're a museum, you have strangers in your facility all day long. What if you're a major campus like the University of Alabama? It's an important thing to make sure that you have covered. For schools, we develop a plan for the entire school staff on how to address illness and then reduce the spread while educating as well, and we need to continue educating our kids, and we talked about that last month. There may be alternate ways. You can even get a GoToWebinar contract and do virtual training sessions, or work with the University of Alabama to create some really terrific training. But there are lots of ways that we need to think through alternative methods of conducting the business of whatever our business is, whether it's education or the selling of goods and services. And we need to prepare for the different types of illnesses that may occur. And the thing that's important to remember is your schools are going to start telling you when something's bubbling up, right? So you can go to the Alabama Public Health.gov website, but also, you know, if the kids are sick in the morning, a parent may feel they need to say, you know what, mommy or daddy's got to go to work today. You'll be okay, and if you feel any worse, just go see the school nurse. Well, how many times has that happened? And then the kids pass it to each other at school, and they bring it back home, and then the entire family gets down with the flu, and the next thing you know, you're sitting at that, I've got 40% of my people missing stage. So Ken, let's talk a little bit about some basic things that you need to teach people to do, young or old, when it comes to any type of communicable illness.
Thank you, Karen. Number one is stay home when you're sick. You avoid close contact with people who are sick. Cover your mouth and nose when you sneeze or cough. And unlike how we were taught when I was a child, we no longer advocate covering your nose and mouth with your hands. You cover with your shirt sleeves. So bend your arm up and kind of cough or sneeze into your elbow. Wash your hands with soap and water is the best thing you can do to prohibit all communicable illness. An alcohol-based hand rub is also an adequate substitute. So an alcohol-based hand rub in your go bag might be another good thing to have. You avoid touching your eyes and nose and mouth, and clean surfaces. We pass phones and iPads back and forth to use. That device that is being passed is also contaminated if I have the flu and touch it and give it to you. So now you have it. So cleaning surfaces. There are surface cleaners and there are hand cleaners. The two are not the same. You don't use surface cleaner rags on your hands. I also want to make this pitch for the influenza vaccine. The influenza vaccine remains the best way to prohibit flu. It is this year's is a quadrivalent vaccine protecting against 4 different virus types. The CDC predicts what virus will be here in this country. They do this 6 months to a year in advance, and then they start production of that virus that that vaccine, and then that is what is supplied. If they get that guess right, we have pretty good coverage against the virus that shows up. If they miss it, we have varying degrees of protection, but the influenza vaccine remains the best way to prevent yourself from getting the flu. So, thank you, Karen.
Why don't you just continue into this points to consider for your organization real quickly, Ken, and we'll move forward.
This is a one little sample piece taken from our tool, and has you go through a process of thinking about what you'll need to get by in the event of a 40% workforce reduction. So we cause you to think about on day 1, on day 3, 7, 14, and so forth, what are you going to need? How many staff do you need? And what do those staff need in order to work? If you need a copier to produce work, will you have one? If you're dislocated from your business, you're no longer there, will you have access to these things that you need? Thinking about these in advance and writing them down will cause you to be far better prepared. Thinking about them when it's too late, you're scrambling and wasting time that you will need to have to run your business and not prepare for the disaster that you could have already prepared for. Thank you, Karen.
And that, thanks, Ken. And that leads us into what the holistic communicable illness plan is about. So once you've started writing down what I'll need day 1, day 3, day 7, etc., then we start looking at the myriad of other concerns that you might face in the event of a significant communicable illness outbreak, an epidemic, a pandemic. So we use a comprehensive model of HR policies and really bring them to you in a succinct way that allows you to customize them for your organization. The first thing, though, in our Predict.Plan.Perform methodology we want to make sure you're doing is conducting that benchmark gap analysis of your existing plans, your documents, your policies, and procedures. How many of you have walked into not only your organization but another organization, and they have all these beautiful folders and binders on a shelf, and they're color-coded and they're gorgeous, and they've got 4 inches of dust on them because nobody's ever taken them off the shelf once they were beautifully prepared and put up there. So it's great to have a plan, but having a plan that tells you what to do and not actually how to do it isn't going to serve you in the time of a communicable illness crisis. So what we're trying to do is make sure that you create something that's really holistic for your organization, and then let's think of innovative ways to serve it up to people, whether it be via your cell phone or paper is fine, or just via a shared Dropbox someplace might be a helpful way to do it. We want to make sure that we identify what the plan activation triggers and monitoring plans are so that we know when we're about to call a crisis or call an audible on something, and then who does it. We also want to look at developing comprehensive training and testing procedures. So you can create the best plan in the world, but if you haven't tested it to see how it works in the real world, it's not going to do you very good when you actually need it and find out there are gaps in your plan because you didn't test it. And then make sure that you've designed additional solutions to support any mitigation procedures that you might have. You know, large enterprise-level companies have Quonset huts or other sheds on their property, storage containers that have everything from porta potties to chairs, cots, food stuffs, and other supplies that may be needed should people be confined to a facility for an extended period of time. So if something should happen, and what if your people weren't allowed to leave your facility? How many shifts do you run? How many supplies would you need of a certain type? Did you buy those supplies in 1986, and might they need a review and looking at right now to see if they're still even usable? So we want to be sure that we're looking at all of those types of backup design solutions as well. And what you're seeing on your screen is what a communicable illness plan might look like. It has, this is just page 1 of the contents, and then I flipped over to it's about, well, there's 90 some odd pages with addendums and other sheets, again, that you can customize for yourself. And that's all part of our toolkit. But we wanted to even make it a little simpler for you than just handing you a program document and saying, good luck. So last year we wrote a paper called Communicable Illness, and we had a bunch of heavyweights weighing in. We had experts from certainly the healthcare industry, also the legal and insurance industries, and plus Firestorm key expert council members and founders. And they all contributed to some extensive legal questions and human resource questions about what happens during a communicable illness event. You can download that from our website at firestorm.com/illness. No fee for that. Go download that. Start reading through that now, and that's going to help you as you move on to the next steps of what your communicable illness plan needs to have. So what does this paper cover? How about attendance and leave policies? What if you are forced into a reduction in force or some sort of layoff or termination situation? How about when are you allowed to send workers home? When are you allowed to require them to stay? What happens if an employee refuses to come to work because they are concerned about getting ill, or they don't want to travel on business, whether it's in the country or out of the country, because they're concerned about a current outbreak? Do they have a right to do that? How are pay policies addressed and absences? What about special work restrictions? Do you have telework set up? How about social distancing, not just for employees from each other, but also customers, vendors, suppliers, visitors? Do your benefit plans address any of this? Workers' comp, your retirement, your health insurance plans? What about your employee assistance program, visitor policies, and then other policies for your teams? The document itself is really going to help you get a jump start. And then if you're ready for the more complete communicable illness toolkit, just let us know at webinars@firestorm.com. And we'll make sure to direct your request with someone who can help you. It's important for us that you know that proper disaster planning requires you to predict, plan, and perform. Your predict phase is where you classify critical vulnerabilities. The plan phase helps you develop the strategy in the plan, and the perform phase is where you establish the protocols for implementation should something occur, and you'll have tested, audited, reviewed, and updated your approach to your plan. In closing, I'd like to ask Brenda if she has anything she'd like to add today, other than our sincere thanks to the University of Alabama for allowing us to once again share some information with you.
Thank you, Karen. Appreciate all the great information that both you and Ken shared today. I always learn something new, and it just reminds me of my hospital days. I worked in healthcare for over 2 decades, and we were always thinking about what happens in case of a disaster. Do we have everything we need? So it's a great reminder for all of us, and looking forward to continuing our good working relationship, and let us know if you need any information about our Bertha program.
Thank you so much, Brenda. And I encourage everybody to visit bertha.ua.edu. If you have any questions or comments at all, there's a little comment form on the page, and Brenda will see your comments and be able to respond. And the same thing for Firestorm. We have contact forms all over the website, or you can contact us at webinars@firestorm.com. You can also call our 1-800 number if you'd like to speak to the adorable and talented Bill Baker, who's in the background of this session today and is moderating for us. With that, I will say thank you, and Ken, thank you. I'd like to just add in for Ken, if you haven't had your vaccine, go ahead and get that done. And Ken, thank you so much for this series. I've really enjoyed presenting with you. For everyone from Firestorm, thank you. Have a great month, and have a fabulous Thanksgiving. That'll end our session for today. Thanks so much, and have a great day. Goodbye.